Hello guys, I'm Dr. Ravindra Savarkar and I welcome you back to Med School. Topic for this video is heat stroke and other heat related illnesses. Prior to heat illnesses, let's first go through thermoregulatory mechanism of body. When temperature of the body rises above normal, signals are sent through peripheral and central thermoreceptors to hypothalamus. Hypothalamus sends signals through autonomic nervous system and causes peripheral vasodilatation and activation of sweat glands to increase sweating. Heat is lost through dissipation through skin and evaporation of sweat, which brings body temperature back to normal. Similarly, when body temperature falls below normal, signals are sent through peripheral and central thermoreceptors to hypothalamus. Hypothalamus sends signals through autonomic nervous system to cause peripheral vasoconstriction and shivering. Peripheral vasoconstriction decreases heat loss via dissipation through skin, so there will be heat preservation, and shivering generates heat through muscular contraction. Both this process brings body temperature back to normal. So what are heat illnesses? They are nothing but symptoms occurring due to exposure to abnormal or prolonged amount of heat without relief or adequate fluid intake. Here prolonged and abnormal are very subjective terms. For person living in Kashmir, temperature of 35 degrees Celsius is very hot and he or she may develop heat illness. Whereas for person living in hot place like Nagpur, same 35 degrees Celsius is absolutely fine temperature. Similarly, outdoor worker or athlete can easily work in hot sunny day for few hours without developing any symptoms. But a person rarely stepping out of air conditioner will develop symptoms of heat illness in the same time period. There are some risk factors which increases the chances of development of heat illnesses. Sudden exposure to heat, because there will be no time for body to acclimatize to hot environment. Humidity interferes with sweat production and causes inefficient cooling. Evaporation of sweat and cooling requires proper ventilation. Hence, lack of proper ventilation increases risk of heat illnesses. Dehydration or lack of proper rehydration causes decreased sweat production and inefficient cooling. Person under alcohol intoxication will not respond to body signals like thirst or moving oneself to cooler place. Hence, such persons are prone to develop heat illnesses. Medications like beta blocker, antipsychotic, etc. interferes with thermoregulation and increases risk of heat illnesses. Same is case with chronic illnesses like heart or lung disorder, diabetes mellitus, hyperthyroidism, etc. Extreme of ages, that is children or old person more than 65 years, are at high risk for development of heat illnesses. So why are extreme age group prone to develop heat illnesses? As you already know, hypothalamus is the thermostat of body. In children, central nervous system is not well developed. So is hypothalamus. Hence, children adjust to heat more slowly than adults do, as their thermostat is underdeveloped. In old age person, there is neurodegeneration occurring as they age. Hence, thermostat is not efficient. Hence, both these age group are more prone to develop heat illnesses. But in practice, most patients of heat illnesses are adults, as they are the one who usually work in hot sunlight. Heat illnesses are actually a continuum of disorder, which include heat syncope, heat cramps, heat exhaustion, and heat stroke. Heat syncope is the mildest, and heat stroke is the most severe form of heat illnesses. There is another heat illness which does not fit into this continuum, that is sunburn or heat rash. Heat syncope is a temporary loss of consciousness in the presence of heat exposure. When body is exposed to heat, it will cause peripheral vasodilatation and sweating as a thermoregulatory response. But this will lead to decreased venous return due to peripheral pooling of blood and dehydration caused by this response. This leads to reduced cardiac output, which in turn leads to cerebral hypoperfusion causing syncope. When there is excessive sweating in hot condition, it will cause marked electrolyte abnormality along with dehydration. If water and electrolyte are not replaced in time, it leads to painful muscular contractions. So heat cramps are painful muscle contractions after vigorous exertion in hot environments, often for several hours. It most commonly involves muscle in calves, thighs, and rarely shoulders. It occurs due to water and electrolyte loss. I hope you love cricket as most of people in India do. You must have seen players suffering from cramps during matches. They are nothing but heat cramps. You must have also noticed that these cramps occur frequently when matches are played in hot countries in Indian subcontinent, but rarely occurs when matches are played in cold countries like England or Australia. When a person continues to exert in hot condition for prolonged time, thermoregulatory system is overwhelmed by the heat and cannot cope up with the heat produced. Body temperature starts to rise and cardiovascular system comes under stress. This condition is called as heat exhaustion. Symptoms of heat exhaustions are pale moist skin due to sweating, fever, nausea, vomiting, muscle cramps, dizziness, headache, and fatigue. Signs of heat exhaustion are tachycardia, temperature up to 104 degree Fahrenheit or 40 degrees Celsius, profuse sweating, dry tongue and other signs of dehydration, hypotension, and normal mental status. Out of this, temperature below 104 degree Fahrenheit and normal mental status are differentiating factor from heat stroke. Heat stroke is extreme end of the continuum where thermoregulatory mechanism fails completely and body temperature rises above 104 degree Fahrenheit. Such level of body temperature have detrimental effect on vital organs, causing their failure. Hence, heat stroke is an medical emergency. There are two types of heat stroke. Exertional, which occurs due to overexertion in hot and humid condition. This type develop over hours. Second type is non-exertional variety, which occurs in extreme ages, that is children and old age people, or in debilitated patients due to underlying health condition. It develop over several days. Heat stroke present with features similar to heat exhaustion, except profuse sweating. So there is warm, dry skin due to absence of sweating or anhydrosis. There is high temperature, usually over 104 degree Fahrenheit, as opposed to heat exhaustion where temperature is below 104 degree Fahrenheit. Muscle cramps in heat stroke are also associated with muscle tenderness due to presence of rhabdomyolysis. Another differentiating feature from heat exhaustion is altered mental status, which include delirium, agitation, ataxia, stupor, seizures, and coma. Temperature above 104 degree Fahrenheit directly affects vital organ function. Hence, heat stroke causes many complications, but most important are neurological because there is widespread neuronal cell death. Cerebellum is more severely affected than other areas of brain. That's why ataxia is most common long-term neurological dysfunction after an episode of heat stroke. Rhabdomyolysis means rupture of muscle cells. There is abundance of potassium and myoglobin inside muscle cells. These two products are released into bloodstream because of rhabdomyolysis. High potassium or hyperkalemia can lead to life-threatening arrhythmias. Myoglobins are large proteins which can precipitate into nephrons and cause renal failure. Acute renal failure in heat stroke can also occur due to hypotension, leading to acute tubular necrosis. Disseminated intravascular coagulation or DIC is caused due to direct thermal injury to vascular endothelium, activating coagulation cascade. Acute liver failure is due to centrilobular hepatic necrosis, caused due to shock. There are some general principles for management of heat illnesses, like shifting patient to cooler place, loosening tight clothes, removing extra clothing like jackets, socks, etc., starting oral rehydration whenever possible, with electrolyte rich fluid like ORS solution, homemade sugar and salt solution, or fruit juices. Patient with heat syncope should be placed in head low or leg up position to improve cerebral perfusion. Treatment of heat syncope is easy, but one should be sure that it is really a heat syncope only and there is no other explanation for syncope. So heat syncope patient should be thoroughly investigated if there is any doubt. Muscle affected due to heat cramp should be stretched gradually once cramp subsides. Heat stroke is a medical emergency, so treatment should be initiated promptly. Body temperature is brought down with active cooling methods like ice water immersion and evaporative cooling. In evaporative cooling, body is sponged with tepid water and exposed to high speed air for cooling. Target temperature is below 102 degree Fahrenheit. As thermoregulatory mechanism is not working properly, there are chances of hypothermia also. Hence, it is not advisable to bring body temperature to normal with active cooling methods. One should also note that antipyretic should not be used as they interfere with thermoregulatory mechanism. Hypotension in heat stroke is not only because of dehydration, and there is associated cardiac dysfunction due to direct thermal injury. Hence, intravenous fluids are indicated, but not in large amounts. Benzodiazepines are a drug of choice as sedatives in heat stroke, as they does not interfere with thermoregulatory mechanism. Antiepileptics are indicated for seizures. Muscle edema in rhabdomyolysis can cause compartment syndrome. Fasciotomy is indicated in such patients. Hemodialysis may be required for renal failure. Complications due to rhabdomyolysis are preventable. Large amount of myoglobin is released into bloodstream which precipitate in kidneys to cause acute renal failure. This can be prevented with infusion of large amount of IV fluids, alkalization of urine with IV sodium bicarbonate or oral potassium citrate, IV mannitol. Mannitol acts as an osmotic diuretic and helps to flush myoglobin out of kidneys. Large amount of potassium is also released into bloodstream which causes hyperkalemia. This can be treated with dextrose and insulin infusion and IV sodium bicarbonate. If both this treatment of acute renal failure and hyperkalemia fails, then hemodialysis is indicated. Recommendations for prevention of heat illnesses are: drink plenty of fluids during outdoor activities, especially on hot days. Avoid alcohol and caffeinated drinks. Wear light colored, lightweight, tightly woven, loose fitting clothes on hot days. Schedule vigorous activity and sports for cooler times of the day. Take rest period in shade or cooler areas. Increase outdoor timing gradually so that body gets time to acclimatize. Take frequent drinking breaks and weight down or mist oneself with spray bottle to avoid becoming overheated. Sunburn or heat rash is caused due to blockage of sweat duct due to excessive sweating. It is also called as malaria. Symptoms are inflamed skin with erythematous eruptions, which feels pricky on touch. Hence, it is also called as prickly heat rash. Sometimes blisters can also be formed. For management of sunburn or heat rash, stay out of sun until it heals. Put cool clothes on sunburned area or take cool baths. Apply moisturizing lotion on sunburned areas. Do not break blisters. Thank you for watching this video till the end. If you have any query or suggestions, please write it down in the comment section. If you like my work, please like this video and share it with your friends. And to get notified about next video upload, please subscribe to this channel and hit the bell icon. Till next video, take care and keep learning.